Hello, in this session we're going to cover how to deal with a choking casualty. So what's choking then? Well, choking is basically when a foreign object, piece of food, marble for example with children, is actually breathed in and goes down the airway, or food is breathed in and instead of going down to the stomach again goes down the airway. I would imagine everybody has either experienced this themselves or they've seen somebody who basically gets food that's gone down the wrong way, is the phrase we use, and that's exactly what's happened. It's gone down the wrong way. A cornflake or a piece of cornflake for example, and the first thing you see is your casualty would start to cough such as that. Use the first aider. The way you would deal with that is ask your casualty, can they cough and can they breathe and are they choking? If your casualty says yes, I'm choking, then this is what's called mild choking. Because to be able to speak and answer your question, your casualty is able to breathe and therefore it's mild. The best thing to do with that is just to ask them to keep coughing, and in most cases the foreign object will be dislodged and everything will be fine. If on the other hand a casualty approaches you in a manner similar to this and is unable to cough, then that's probably what's called severe choking. Severe choking is where the airway is actually blocked and your casualty is unable to breathe. Again, they would approach you like this. You would ask them, are you choking? Can you cough? And they basically can't respond because they've got no air. They cannot get air out of their lungs. Ask them to cough, firstly, to try and clear the blockage, but it's unlikely that that will do so. So we then move on to the practical side of dealing with a choking casualty. Hello, we now come on to the practical side of how a first aider should deal with a choking casualty. This is a tool that we use, it's called a choking vest. It's the best thing we can do to demonstrate the technique. As you can see, the mannequin's sat on my knee, but in real life, with a real casualty, excuse me, you'd have them stood up and you'd bend your casualty well forward and get the head as low as possible. But I'll demonstrate using this tool. Okay, so your casualty's coming to you, presenting with, for example, hands around the throat. They can't breathe. The first thing you do is ask them to cough. Cough it up, go on. So he's tried to cough, but that's had no effect. So the next thing we do is move on to back blows. The idea is you give your casualty a firm, hard blow between the shoulder blades and hopefully that will dislodge the obstruction in the airway. So we give up to 5 back blows, but if the obstruction is removed or it comes out, then stop at that point. If that doesn't work, we go on to what's called abdominal thrusts. The way we do that is form a fist with one hand, place it just above the belly button, reach around with the other hand, and we form a movement which goes inwards and upwards at the same time. What this does is forces air out of the lungs, which hopefully will dislodge the obstruction. 1, 2. As you probably saw there, the obstruction came out. If it doesn't, keep going up to 5 times with the abdominal thrusts. If it's still not dislodged, move on to 5 back blows and continue that routine until the obstruction comes out or your casualty becomes unconscious. If your casualty becomes unconscious, then move on to CPR. So what about giving rescue breaths then if there's an obstruction in there? Well, yes, the answer is that you do, because it can force the obstruction further down into one of the lungs or one of the bronchi, and then that opens up the other one so that your casualty can still breathe. Okay, we've just done adult choking. For a child, then the situation is exactly the same, but you bend the child over your knee rather than have them stood up. So let's move on to a baby then. Obviously a baby's much smaller, but you still give back blows and you still do chest compressions. So to do back blows, turn the baby on its front, head down and support the baby's head. And again, 5 back blows, but obviously much gentler. If that doesn't remove the obstruction, move into chest compressions. The way we do that, again, support the baby's head and use 2 fingers as so. And again, alternate between the two.